Welcome, dear viewers, to your program, DocTalk, where we discuss important health topics in a simple language so we can help you understand illnesses and symptoms more clearly. So this is me, Maraheb Alqalaf, and my colleague, Dr. Sundos Alhadhoud. And you figured what we're going to talk about today, which
Definitely, it's about muscular dystrophy.
Yes.
And I am so excited, Maraheb, because it brought back a lot of memories.
Yes.
I have seen a lot of patients having different types of muscular dystrophy while we are training, while we were taking our PhD in pediatrics. And I think you did the same thing while training
Yes.
in your specialty.
Yes. And I still see the cases, honestly, on a daily basis.
Yes, definitely. But I think people, they don't have an idea about them. When they hear muscular dystrophy, they immediately think about wheelchair, death, paralysis, disability.
Yes.
But people, they don't have an idea about that there are many types of muscular dystrophy, and they have certain degrees from very mild to very severe. And this is what we're gonna discuss more in details in our today's episode.
And we talked about the statistics, so there are actually more than 30 types of muscular dystrophy.
Yes, definitely. And still there are ongoing new discoveries, because sometimes some of them are related to genes and family history, but there are a lot of cases that the cause is unknown, and it's still there, the gene behind the dystrophy is not discovered yet. That's why still there are new discoveries, and I think the numbers are on the rise.
So there are different types of, as I mentioned, muscular dystrophy. So we have the common one, which is Duchenne, and we have ALS, amyotrophic lateral sclerosis, and we have SMA, spinal muscular atrophy.
Yes.
And there are so many types, but for me, those are the most common ones that I see for the rehab journey actually in the clinic.
Definitely. And Maraheb, we also see in my practice, whether I was a pediatrician or pediatric cardiologist, because when I was pediatrician, I saw a lot of cases of spinal muscular atrophy. And you know, spinal muscular atrophy per se has 5 types by itself.
Yes.
So it's from very, very severe that the baby will be born dead to type 1 where the symptoms will appear immediately after birth, and the life expectancy is not up to 1 year. So they die usually before the age of 1 year. And I saw actually a couple of cases while I was training for my pediatric board exam. And then there is type 2, while they start from 6 months to 1 year to show the symptoms. And then the type 3, where from 1.5 years to adolescent. And then there is the adult type, where they started to have the symptoms at that time. The difference between them is the mode or the severity of disability. As we said, some of them will die early, some of them will be bound to wheelchairs, and some of them will have only difficulty in getting up from sitting position or getting up from bed or even sitting back. So it depends on the type and depends where is the defect. So as usual, I think I'm the queen of neurophysiology and physiology explanation.
You're amazing at it.
So we have to know the underlying pathology or pathophysiology behind the disease, and it's called dystrophy because it is related to dystrophin protein. Dystrophin protein is deficient in those patients, and usually this protein is in charge of integrating the muscles and fibers and cells of the muscle itself. So this protein is very important. It helps the muscle to contract and relax. So if it's deficient, then definitely the muscle will not be able to coordinate the contraction and the relaxation. This protein is very important. It helps the muscle to contract and relax. So if it's deficient, then definitely the muscle will not be able to coordinate the contraction and the relaxation. So one of the types of the dystrophies, muscular dystrophy, is when they shake hands, they cannot relax. So they will have firm grip. Imagine at that severity. So as we said in statistics, and we're going to say in this episode, that not all of them will be bound to wheelchair, not all of them will have disability. Some of them will have manifestation depending on the type.
And depends on the proper care also and the rehab journey as well.
Exactly. And spinal muscular atrophy, definitely it is type of muscular dystrophies, but it has nothing to do with dystrophin protein. The problem is in the spinal cord cells. They cannot integrate the messages or signals
yes.
from the neurons into the muscles.
Yes.
So it's a neuromuscular disorder where the neurons or the central nervous system and the muscle system are involved.
Right. So it's very important that we understand, like, actually, the brain and the spinal cord is very important, right?
Yes.
To send the signals to the right places, to the right muscles, so we can function actually on a daily basis. So anything that interrupts sending the signals, interrupt those two areas or parts, it's going to affect the whole body.
Exactly. And also it's worth mentioning that it does not only affect the muscle. So we don't think about disability only. There are other systems involved. So one of the types of muscular dystrophy is the genetic form, or the myotonic dystrophy. It's a very severe form, and it involves the electricity of the brain and the heart. So they will have epilepsy, convulsion, and they will have arrhythmias of the heart. And most of them will have pacemaker insertion in order to coordinate the electricity of the heart. So not only the muscles are involved, definitely other systems are also involved in the disease.
Actually,
yes.
Everything is in the body is interconnected.
Definitely. And it's worth mentioning the mode of acquiring the disease.
Right. So
some
we
of
have
them,
the genetic factor.
Yes.
Right.
And some of them are autosomal X-linked recessive.
Like Duchenne.
Exactly.
It happens in boys or males more often than females.
Yes.
Because it's X-linked, and we know boys have the XY chromosome while females have the XX chromosome.
Exactly. So the mother will be having the disease and might be a carrier, and then she will transmit the disease to her son.
To her baby boy.
So
yeah.
I think we should dig more into the causes and why does a person have muscular dystrophy after the myth and facts segment. Stay tuned with us.
Stay tuned.
And now we will come to the segment that you have been all waiting for, which is
myths and facts, which is the most interesting actually segment.
Exactly. So would you like to start, Maraheb?
Of course. So I have a myth that says muscular dystrophy is only a muscle disease.
Oh, wrong.
Definitely. So in fact, it is part of this myth true because it is a condition that affects the muscles, but all of our body is composed of muscles, so it definitely affects cardiovascular system, respiratory system, and other systems in the body.
Definitely. Well said, Maraheb. So my myth says that all patients with muscular dystrophy have shortened lifespan. True or false?
No.
Definitely. Not all of them, only the severe form, but there are a lot of milder and moderate variation of the disease that will have a normal lifespan.
So my myth says that people diagnosed with muscular dystrophy can't study or work.
No, their intelligence is not impaired.
Yes, so their cognitive ability is definitely not impaired. Plus, with the proper care and right accommodation, especially at the educational setting like school and home setting. So if the family is involved to support actually the person, they're going to excel and they're going to have a good life, proper education, and good career.
Well said, Maraheb. So my myth says that muscular dystrophy only happens in children. True or false?
No.
Definitely. There is only the severe form or the genetic form that happens during childhood, but the rest of muscular dystrophies actually happens in the second and third decades of life.
So I have a myth. I have another myth actually. It says if the person is diagnosed with muscular dystrophy, it will cause complete paralysis.
No.
It's not related actually.
Yeah.
So the degree and the progression actually varies on the condition. So it doesn't mean necessarily that the person will have complete paralysis.
So I have the last one, which says that all patients with muscular dystrophy will end up on a wheelchair. True or false?
No.
Definitely. As we said, only one type or two types, the genetic and the Duchenne muscular dystrophy, will end up on a wheelchair. But the rest of types of the muscular dystrophy, actually, they will have normal, let's say, not affected way of movement.
You know what? I just remembered another myth.
Oh, good.
It says physical therapy is a waste of time and it's pointless. What do you think?
Oh no, it's very important.
It's very important because with physical therapy, you're gonna preserve the muscle mass, you're gonna try to preserve the mobility, and it's gonna try to actually reduce the progression of the condition.
Well said.
Welcome back, dear viewers, and we're gonna talk more about muscular dystrophy. And now we're gonna talk about the causes, signs, and symptoms.
Definitely. So I was saying before the segment that genetic plays a good factor or a major factor actually in acquiring muscular dystrophy. So as you said, Duchenne muscular dystrophy is one of the commonest type, and it constitutes 45 to 55% of all muscular dystrophies.
Oh, wow.
So it is X-linked recessive, autosomal dominant, and autosomal recessive.
Oh, wow.
So see how many modes of inheritance.
Yes.
It's not one mode.
Yes.
Usually the mother, either she have the disease and this is autosomal dominant, so the mother is affected but have mild symptoms and she gave it to her son,
Yes.
or she's a carrier, which is autosomal recessive and X-linked recessive. So how do we know? I had many patients with Duchenne, and when I asked the mother, do you have any weakness? And she would say, yeah, I cannot comb my hair. I have weakness in raising my arm, or in shampooing my hair, in using my hand in cooking.
Right.
So
it makes sense, actually.
Exactly. So at this point, she knew that she have the disease, but she have the milder symptoms.
Right.
And then there is the second most common, which is Becker's muscular dystrophy. And it's exactly the same as Duchenne, but the time of appearance in Duchenne, it appears between 2 and 5 years. In Becker's, no, it usually appears in adolescent, even adulthood.
Right.
So second, in their 20s, the person will start to have the symptoms.
Right.
And usually they don't end in wheelchair in compared to Duchenne muscular dystrophy, where in their adolescent they will end up in their wheelchair.
And you just reminded me, Dr. Sundos, especially about Duchenne. People maybe don't know, or parents don't know if the child has Duchenne or not. So you're going to notice developmental delays, right?
Yes.
Especially with anything that has to do with the physical and motor skills. Maybe they're going to be delayed in sitting, delayed in walking. It's going to affect balance. I know for a fact, I learned something from a colleague who is a physiotherapist, and she mentioned when they want to stand up, they usually hold their legs when they stand up because they need some assistance to lift themselves.
You know, I saw patients and they put their hands here in order for them to support them for standing.
For the trunk, yes.
Exactly. So this is the place where they usually use, and this is how we know that this patient or this person have muscular dystrophy.
Right.
And then you have to dig deeper. But as you said, they might show symptoms even early, and one should put in mind.
Right.
So late or delayed walking, delayed sitting without support.
Right.
A child at 6 months of age or 7 months of age should be sitting without any support.
Right.
There is a curved back, but at least steady in sitting.
Right.
If the child at this age is not able to support him or herself and is falling, then definitely, exactly, he needs to be checked.
Yeah.
Walking and then falling while walking or running.
No balance.
Exactly. So these are the signs and symptoms that a person should look for. Spinal muscular atrophy, when I mentioned how we diagnose them, usually all the muscles in their body are involved. And one of them, and most important one, is the respiratory muscles. So the muscles in charge or having control on the movement of the chest, they are involved. So they have recurrent chest infection, respiratory depression, they will have mucus, they will have phlegms. So these are the signs that we know that this person needs to be investigated.
Let me test myself, because you're the queen of anatomy and queen of neuroscience, right? So when you talk about the respiration muscles, so is it like the diaphragm and the intercostals? Is that what you mean?
Exactly.
I passed the exam, right?
You're good. You're the neurophysiology or pathophysiology princess.
Thank you. I'm learning from the best, actually.
Thank you. So definitely there are muscles between the ribs And there we have the biggest and most important muscle, which is the diaphragm. So the diaphragm, it helps in expanding and relaxing the chest and the lungs. And these muscles between the ribs are also important because they're the ones who help to put them apart and bring them back together in order for the chest to expand.
Right. And most of the patients with muscular dystrophy, actually, they have problems with pronunciation. Their muscles for feeding, swallowing, and language, especially with the speech sounds, they do deteriorate with time. So they need a lot of help, especially with speech therapy, to have this better and improved muscle tone and find like modification strategies for them so we can help them to pronunciate words and communicate in general.
Definitely. And one of the muscles are the spinal muscles, or the muscles in the back, and they are aligning the vertebra or the bones in the back
to hold them in place.
Exactly. And if they are involved and they are not used, the problem with the muscles, when you don't use them, they weaken and they start to shrink and then replaced by fibrous tissue. The fibrous tissue are like rubber. It's not like the muscle, very soft and expanding and de-expanding. So if it's replaced, then we will have scoliosis. So we see that a lot in patients with all types of muscular dystrophy.
Right. So one of the important things that we have to actually highlight is exercising and physiotherapy is very important to preserve the muscles that you have. So exercising will not make the condition worse, it'll help.
Definitely. And because also, as we said, the muscles, if are not used, then they will start to atrophy and the tendons will start to pull the muscle.
Especially for people or patients who are admitted and, you know, laying in bed in the ICU for a really long time. They need some kind of movement, even if the movement was passive, but they need to actually move their muscles.
Do you know why? Because the muscles, they have memory, like our brains.
Muscle memory.
So if you do the physical exercises, even that person is not moving or not using the muscles, you want the muscle to remember its activity and its size. So I think, Maraheb, we covered most of the causes and signs and symptoms of muscular dystrophy, and now we come to the most important part, which is how to manage and how to deal with patients with muscular dystrophy after Healing on a Plate report. Stay tuned with us.
Welcome back, dear viewers, and we're going to talk about the management of muscular dystrophy, which is the most important segment you've been waiting for. So for especially speech therapy, feeding and swallowing, most of the patients, they do struggle since their conditions might worsen and progress with time. We want to make sure that the patient actually is feeding in a safe way. We have to check the oral phase, which includes how the patient actually masticates and chews the food in a proper way without pocketing the food in the cheeks. And we have to check the pharyngeal phase, actually, how they can transfer the bolus or the chewed food from the mouth or the oral cavity to the larynx. But it has to go to the right way, which is in the esophagus, not to the trachea, which is the windpipe. So we have to actually teach the patient and teach the family how to feed properly. Even if it needs to change the texture of the food. If they cannot tolerate chewing solids, we can go for pureed and soft food. And another thing that I have to mention, and it's worth mentioning, especially for cases of Duchenne or ALS, because the body is composed mostly of muscles, right? And the vocal folds are made of muscles.
Yes.
So the vocal folds are actually made of muscles. And with time, they do progress and weaken. So they might not be able to produce their natural voices anymore. So we do something called voice banking. So if they speak and they have a beautiful voice with a good quality, we start saving and recording all meaningful phrases with their natural voice, and we save it for later until the condition worsens, so they can actually use it through AAC, which is an augmentative device, a smart device, so they can be able to express their love for the family, express their needs. So we do rely on high technology, not only low tech using pictures. We do recommend actually high-tech
It's really
devices.
interesting.
Yeah,
it's really.
It is.
And have you seen any cases?
Oh yeah. Oh yeah.
Oh, nice.
So we do see lots of cases of ALS and Duchenne. And another thing actually, not only the use of AAC, sometimes we use buzzers like yes, no, buzzers, the red ones and the green ones. And now with AI, even if they lose their voices, there is hope with the vocalizations and the use of vowels. We can extract different voice for them, like specialized and individualized for them. Nice.
It's really interesting, Maraheb.
It is.
And I think the other thing that it's worth mentioning that there is no definitive treatment for Duchenne, for all muscular dystrophy. Exactly. The thing that we do is that we try to treat the complication and manage the symptoms and improve the quality of life. So one of the things we said that it will some of forms will affect the heart. So pacemaker insertion is one of them. We will sometimes we require calcium channel blockers. It will help to in relaxation of the muscles, even though that it is used for the heart. But it also has a side effect. It relaxes the muscle. So it might be used in some forms of muscular dystrophy. There are some experimental management or genetic management. Till now it's under trial, and there is no definitive results for the time being, but we are hoping for a better future.
Yeah, definitely. So actually the management requires a multidisciplinary work, multidisciplinary team, so we can actually tackle the condition from each side, from different angles, with your help, with especially the medical perspective, with the rehabilitative perspective. It's going to help a lot, even with the involvement of physical therapy, psychology, to support them socially and emotionally, and provide the necessary support for the family as well. So it all works really good for patients with either ALS, Duchenne, SMA, or any other types of muscular dystrophy.
And there is the Muscular Dystrophy Foundation that you can just Google it and you will find all the information that you require. They have annual conferences, they have annual meetings, they will answer all the questions that you have. Some cases are sharing their experiment. So it's really good if you just you can search it online or in the social media and see that also many celebrities, they have it. So you just
I can recall one person. Is it Superman, right? I think he had ALS.
Yes. Exactly. And not all muscular dystrophies are genetic. Some of them are acquired. So not all of them you are born with them. Some of them with the future you might have them. And it's either because immunodeficiency or autoimmunity. It might be because of viruses, trauma, any surgery done, malignancy. All of these might cause muscular dystrophy. And there is a part that we mentioned before, the cause is unknown. Sometimes people will develop in their adolescent, in their 20s and 30s, and then the cause is unknown. They will do the genetic, they will do everything, and it will be normal. So this is the problem. All of these needs further investigation. And as you said, people with muscular dystrophy usually are depressed because now they are losing the function progressively. Exactly. Some of the types, the severe forms. So social support, family members, school, especially if those develop it in their teens. So school support, they put like lanes for wheelchair and put the classes in the ground floor instead of the first or second floor.
And the use of AAC while in classroom, and also accommodations at home. It'll help a lot, especially with the help of occupational therapists to manage the home environment instead of bumping into things, unnecessary things, or maybe the bathroom. So they can actually help to adjust the home environment in a way that suits the lifestyle of this patient.
Definitely. So support is very important, and having muscular dystrophy is not the end of life. As we said, many forms are mild to moderate, only few forms are severe. So there's always hope, and always there are new technologies, new advancement in medicine.
Never lose hope.
Exactly.
Yeah.
You just ask the experts, ask the ones who have the disease, and they can give you a clue on what's going to happen for the future.
Definitely. So remember, teamwork is dream work. So you require the holistic approach of having multiple disciplines to treat you and manage the symptoms at the same time.
I like the phrase, teamwork is dream work.
Yes,
Definitely.
And you can see actually the outcomes. If you have different disciplines, they know what they're going to do. You're going to support all areas of the condition.
Definitely. I think we covered every tips and points regarding muscular dystrophy, and I hope you enjoyed today's episode, and hope to see you again in a new episode in our program, Doc Talk. You take care.
Never lose hope. See you next time.